So you run a specialized healthcare clinic, or maybe you're a doctor that is a doctor owner, or maybe you sit on a board of doctors that run a specialized healthcare clinic like yourselves. You have multiple locations and you are in a highly specialized niche like pain management, orthopedic surgery, neurosurgery, etc. And you're looking for a partner or resources to help you not just grow your business, but now it's time to scale. And that's where it can get tough, right? First and foremost, you can never forget why you got into this, which was to take care of patients. At the heart of it, that's who you are and that's what you do. And so as you're looking to grow and to scale, every call that comes in, every form fill that comes in from the website, every chat that comes in is a patient needing help. And that mission has to be communicated throughout the entire company, because as you look to scale, all the little areas of the practice that may not be fully optimized in patient care or patient communication are going to be magnified. So first and foremost, we can't just focus on business growth from just driving more calls or driving more forms. We have to understand, where is your practice at now? Where is your healthcare facility at now? And where do you want it to be in 5 or 10 years? Now, with that said, this industry is one that we absolutely love. And for myself personally, I've been in healthcare marketing even before Striventa. And I loved it. I love being able to know that the services being provided were actually helping people. I love being able to see lives changed and transformed by the work of doctors, seeing that connection, seeing the before and the after success stories, specifically in the pain field, for instance, being able to see a patient go from debilitating pain to walking around just fine, and being able to go back to normal functions of being a mom or a dad or a grandma and being able to pick up their kids again. Like, those were the stories that really touched me. And so in that light, healthcare is a specialty of ours because we've been in it for 15 years. We know what you're going through as a doctor in terms of patient communication hangups or getting patients on the schedule. We know what it's like to have patients calling in, maybe not understanding everything you do about your practice because it wasn't on your website. And so our goal in this industry is like yours. We have to come alongside of these patients together and build trust. And that happens through content and process. Those are two key paramount items that we believe in, especially in this industry, that will help you not just grow your practice, but scale it. Content that builds trust online, patient education, patient resources, being able to reach out to them in automated fashions that aren't spammy, but that continue to provide education and resources so that they understand that you and your company are the authority in the space. Why? Because first and foremost, you care the most. You want them to have the best outcomes they can have, but also because you provide the levels of process and convenience that they require nowadays. Consumers nowadays are especially smart online, and they're searching for every little thing, every little problem that they're going through, and you have to be the educator to build that trust. And so our goal in the healthcare space with you is not just to drive more calls or drive more forms, but to really understand what a qualified lead is for your practice. Do you take insurance? Do you not take insurance? What types of insurances do you take? Do you prefer cash pay rates because they're better for the patient and better for your practice? All those little nuances make up the type of patients that you can drive online. And then once you dial that in with us, then we look at your call center or your intake team so that they understand if you get 100 calls that come in, but maybe 50 of them are perfect patients, what happens to the other 50? Are you still providing those resources that they need? Even if your practice isn't the right fit, your reputation's on the line. And you have to understand that that call to helping a patient doesn't just exist within the 4 walls of your practice. That exists everywhere online, especially as you become an authority to be the educator. And if they're calling into your business or your practice with questions or concerns, you have to be able to build that relationship, answer those questions, and even if they're not the right fit, still provide resources for them so that we can send them on their way with the type of patient care that you would provide to them if they were in your practice. All of those little nuances matter and they add up. We have to be mindful that in the industry that we're in the healthcare space, we're in the business of helping patients transform their lives. Whether it's an elective surgery or not, your healthcare practice is established to help patients. And it's through that industry knowledge that we really like to partner with you, even down to getting you in our studio on camera, answering questions. I didn't go to med school, and I'm not gonna pretend like I am. But I do know the sauce and the puzzle that we need to put together to take your expert insight and put it into our program. And so even stopping by our studio once a month and answering 5 to 7 questions, it allows us to take your expertise and put it to work for you online with any marketing opportunities you're doing, any events that you're at. If you have a referral team of marketing associates that are out there driving around building relationships, we have to take that content and make it accessible and approachable for every part of your company so that it can be doing work for you while you look to grow your practice. Also, in healthcare, we have to understand that people that are calling in need answers right away. Not to convert them onto your schedule right away, but so that they stop calling your competitors. What happens is if you don't answer that phone or that call or that form fill right away, and you think that a contact form fill or a request an appointment form fill can be handled in a few hours or tomorrow, that's not gonna fly in today's market. You have to be able to talk to these patients right away, answer their questions right away, not for the sake of getting them on your schedule right away, but being able to build that relationship and build that trust and walk them appropriately through that process. So as you look to scale your healthcare practice, you need to make sure that you are being consistent day in and day out, making those investments month over month for a minimum of 12 months. It's not because we want to just sign you up for an annual program, but it's because your healthcare facility is not just looking to grow a little bit, but you're looking for scalable and sustainable growth. And that's tough to do. So you have to make sure that you are consistent day in and day out with creating compelling content, building trust every single day. Every person in your company needs to be bought in on building trust with this patient or prospective patient. And then lastly, you need to make sure that you have the right tech stack in place to track these results. The last thing you want to do is fly blind. Through marketing and through your sales processes, to getting a patient on the schedule, there are so many nuances that you have to track. By partnering with us, making sure that you have the right tech stack in place, like a CRM. We love HubSpot. They're HIPAA compliant now. We also love call tracking metrics, CallRail. They have HIPAA compliant features as well. And understanding where your best source of patients are coming from. Is it organic? Is it paid? Is it social? Is it paid social? Is it email? Is it referral? Is it direct? The list goes on. You have to make sure you have that granular data available so that as you look to cast the vision of where your healthcare practice is going, you know the best places to invest your dollars and cents so you can continue to help as many patients as possible.